Welcome. You have been scheduled for a procedure with me, Dr. Ruan Louw, and my team. Although we have not been able to meet in person yet, I'm sure you probably have a lot of questions. I hope that this short video will help you understand a bit more about your condition as well as your upcoming procedure. So let's delve into some of the basics as to how our most precious organ, the heart, works. The heart has 4 chambers. The top 2 chambers are known as the atria. The bottom 2 chambers are known as the ventricles. The heart beats as a result of an electrical wave that moves through the heart. Under normal circumstances, a heartbeat occurs as a result of an electrical impulse that is generated by your natural pacemaker cells. These pacemaker cells are located in the right atrium. Each electrical impulse creates an electrical wave that moves through the atria. This electrical wave activates the atria to contract and squeeze blood through valves into the ventricles. The electrical wave then travels to the ventricles down a main nerve that connects the atria to the ventricles. This nerve is known as the AV node. The electrical wave then reaches the ventricles, thereby activating them to contract and pump blood to the lungs and the body. You have been diagnosed with having a heart rhythm disorder known as premature beats. After carefully scrutinizing the medical information sent to us by your referring doctor, we are confident that the most appropriate form of treatment in your case would be for you to undergo a procedure known as a percutaneous cardiac ablation. Let's start off by discussing what premature beats are and how they may interfere with your quality of life. Premature beats most commonly arise from the lower heart chambers. They are termed ventricular premature beats. Premature beats that arise from the top chambers are known as atrial premature beats. These premature beats may result in a variety of symptoms. You may experience a feeling of intermittent skip beats or stop-start beats, which may result in an abnormally slow pulse rate. Other symptoms include a feeling of chest pressure, shortness of breath, fatigue, lightheadedness, and rarely loss of consciousness. Although this arrhythmia may negatively affect your quality of life, it is rarely life-threatening or dangerous. A rare exception is when heart failure may develop in patients that experience a very high burden of these abnormal beats, usually more than 1 abnormal beat for every 9 beats on average. Most patients with premature beats have healthy hearts with no obvious identifiable cause of the premature beats. By now, your doctor would typically have performed blood tests to rule out unlikely reversible causes such as thyroid and electrolyte abnormalities. Treatment of the rhythm problem is indicated in patients where symptoms are negatively affecting their quality of life or in patients with heart failure. Treatment options include medication or a procedure known as an ablation. Medication, unfortunately, has several drawbacks. It usually is not very effective in eliminating the premature beats. It is not curative and often associated with unacceptable side effects, such as fatigue and low blood pressure. The most effective medication, known as amiodarone, has risks of severe organ toxicity that may irreversibly reduce visual acuity and cause lung damage, as well as abnormalities of thyroid function, to mention a few. You have been recommended to undergo an ablation procedure in view of several factors that count in your favor. First of all, your symptoms and frequency of the abnormal beats are severe enough to warrant invasive therapy. Secondly, ablation therapy is much more effective than medication and fortunately often curative. Lastly, the benefits you're likely to experience having undergone a successful ablation outweighs the potential risks of undergoing a procedure. The success rate and risks associated with an ablation procedure differs from one facility to the next and is to a large extent dependent on the experience and training of the treating doctor and his or her team, as well as the technology available at the treatment facility. We are proud to be able to say that we are one of the most experienced ablation centers in Africa and are thankful to have high success rates with very low complication rates for our procedures. In the case of your planned procedure, the risk of a major complication is estimated as less than 0.1%. Major complications include the need for a pacemaker because of the procedure, a small hole in the heart, which in rare instances may require surgery to mend, and even more rarely, a stroke. Minor complications, such as groin, bruising or bleeding, occur a bit more frequently, but usually resolve spontaneously without requiring intervention. The ablation procedure for the treatment of premature beats is unique in the sense that local anesthesia is almost always recommended over general anesthesia in order to maximize the success rate of the procedure. Sedatives and anesthetic agents suppress the arrhythmia, thereby reducing the chance of success of the procedure when administered. The ablation procedure is performed by inserting 2 to 3 small tubes known as sheaths under local anesthesia into the vein in the right groin. Small spaghetti-like catheters are then gently and carefully advanced up the vein into the heart. With the help of the most state-of-the-art equipment and 3-dimensional mapping technology, we meticulously map the small area of tissue responsible for causing the abnormal premature beats. Once located, a series of small applications of radiofrequency energy are administered to the tissue, usually resulting in permanent elimination of the abnormal beats. Although the procedure is usually not painful, some patients may experience some chest discomfort during stages of the procedure, a small price to pay for a good end result. The procedure usually lasts about an hour but may occasionally last longer. Most patients are discharged home the next morning. Normal duties can usually be recommenced after 2 days. Exercise should be avoided for 2 weeks after the procedure. Although we have performed thousands of procedures similar to the one you are about to undergo, we realize this may be your first time. Seeing familiar faces on the day of the procedure may help you feel more at ease. My team and I look forward to helping you. See you soon. This video is for educational purposes only and does not constitute medical advice.